Hello everyone and welcome to the next episode of the Explained series with the host, Dr. Bret Palmer. Today we're going to be talking about the prevalence of herpes. Now herpes comes in two forms, HSV1 and HSV2. Both are quite common, but HSV1 is far more common than HSV2. So what is HSV1? Well, HSV1, also known as a human herpes virus, is usually found around the mouth, and it is otherwise known as cold sores. But if you go to places like Germany and other places in Northern Europe, it's called oral herpes. Genital herpes tends to be HSV2, or human herpes virus number 2. Now it behaves in a very, very similar way as to cold sores, but HSV2 tends to outbreak a little bit more than HSV1, and the common symptoms for both HSV1 and HSV2 usually tend to get a little bit of tingling, and then after anywhere between 1 to 3 days you then tend to have an outbreak of blisters, and those blisters break down into sores. The sores stay for anywhere between up to 7 days, and then the skin returns back to normal, and you may never get an outbreak ever again, or you may get an outbreak in anywhere between 2 to 8 weeks. How should you test for herpes? The best way to do it is just by clinical examination, and most doctors will be able to tell you, yep, you have cold sores or you have genital herpes just by looking at it. The best way of actually defining or confirming the diagnosis is with a genital swab or an oral swab. It is a typical virological swab that is sent off for something called PCR to pick up the DNA of the herpes virus. What I recommend, and so do the British, European, and also the CDC, all recommend, is that you don't have a blood test, which is a screening test for herpes. Why? Well, because 90% of the population over the age of 50 have some form of herpes on board. Now, I get comments around about 1, possibly 2 a week, explaining where do you get your stats from, 90% is wrong. Well, let's actually go through those stats. So if you put in 90% of the population have HSV into Google, what do you get back? One of the top results that comes back is from the World Health Organization, and they say from 0 to 49 years, 66% of the population will have some form of herpes. But that's not quite 90. What about the other 27%? Well, if you go to the Johns Hopkins School of Medicine, they do a lovely article about what is the average prevalence of HSV, and they say 90%, but it is on the over 50s, and the majority, the vast majority of individuals have HSV1, that's a cold sore virus, whereas a much smaller majority have HSV2, which tends to be the genital virus. So what does this mean? Does this mean that up to 90% of the population are walking around with a sexually transmitted infection? Yes, because sexually transmitted infections are very, very common, and most of us have had or been exposed to some of these infections at some time. If you do have a lot of sexual partners, then your risks of picking up other infections like chlamydia, gonorrhea, syphilis, mycoplasma genitalium, HIV, etc. is increased. And it's important to recognize that with increased risk comes increased chances of acquisition. But herpes is a little bit different, because the vast majority of herpes cases are actually picked up before you're sexually active. And normally it is around the mouth or the head as HSV1. But can you get HSV2 around the head? Yes, you can do. Because of oral sex, it is possible to have HSV1 around the mouth or around the genitals, and it's possible to have HSV2 around the mouth, or more commonly around the genitals. But you can also have herpes outbreaks anywhere on the body. And if you do have herpes, for example, on the chest, the back, the leg, or one of the buttocks, that's generally classified as herpes gladiatorium. If you've never had a symptom of herpes, should you take a blood test to check to see if you have herpes? Well, let's go through it logically. Imagine you've never had a herpes outbreak, either orally or genitally, and you go for a blood test, a typical screening test that some health company has conned you into doing and paying for, and it comes back positive. What does this mean? Okay, so congratulations, you've now been diagnosed with herpes, and you're probably going to be sabotaging your own sex life. It doesn't give you any information apart from anxiety? Should you tell your partners that you've been exposed to HSV1? I've been berated on this channel a few times by people who are saying everyone should test and everyone should tell other people, so people who are negative know what they're getting into. Well, there's a few problems with that. One, if 90% of the population have herpes, are you trying to tell us that 90% of the population are diseased? Well, you can leave your comments below. I say no, because it's a human herpes virus. There are other human herpes viruses. But what about human herpes virus number 3? Everyone in the world's near enough had that, and that's called chickenpox. So if someone's had chickenpox, it stays in your body lifelong. Does that mean you are diseased? And also about cytomegalovirus, or Epstein-Barr virus. Epstein-Barr virus is human herpes virus number 4. Does that mean someone is riddled with human herpes virus number 4? Of course not. They're human herpes viruses for the same reason. If you don't want these viruses, well, you can't be human. It's as simple as that, because herpes viruses are common in every mammal on Earth. Why have mammals evolved alongside herpes viruses? Well, simply because it helps our immune system. So another group of individuals which would benefit from a herpes blood test are pregnant women. Now, pregnant women in the last trimester are at risk of herpes. The risk is not to them per se, but actually to the unborn baby. Now, if the baby is born and the woman at the time is having an outbreak of herpes, then there is a high chance the baby will catch it, and a high chance of neonatal morbidity or mortality. In other words, the baby is going to be harmed by it because it tends to go to the brain. And unfortunately, you don't want that at all. And so if you're having a series of outbreaks and you don't have any antibodies to it, you may want to consider a cesarean. But even if you have had herpes before and you know you've got antibodies to herpes, you still may want to consider a cesarean. In conclusion, 90% of the population will have some form of herpes on board by the time they're 50 or older, but there's nothing to worry about. You're human and you're supposed to have human herpes viruses on board. It's a little bit abnormal if you don't have herpes on board. I hope that helps. Take care. See you in the next episode. Bye-bye.